Have you ever taken a rocket to the moon? Sure you have. Metaphorically, at least. You do this in your role as a clinical attending all the time. But if your rocket didn't hit the target, perhaps you didn't give effective feedback. Have your learners ever experienced this?
Good job.
Or seen this? Or heard this?
Okay, we're done. Call me if you need me.
Seriously? That's my feedback?
Do you give effective feedback? Does your feedback actually help your learners to improve their performance? Does it help them reach their target?
We know we're asking for a lot. This is hard, like rocket science hard. To give good feedback, you need to deliberately observe. Decide which behaviors are worthy of feedback. Take the time to give good feedback, choosing words that are helpful, not hurtful, all while simultaneously making medical decisions and taking great care of your patients. Whew, that's a lot of metacognition. The good news is you don't have to give feedback on every little thing. You get to decide when, where, and how.
So what do you say? Let's learn how to give effective feedback.
Before we go further, we should stop for a moment and define what we mean by effective feedback.
Effective feedback from any system occurs when the output is processed and routed back as an input to create a cause and effect loop. In rocket design, the feedback helps you hit your target. From takeoff, the rocket transmits information to the controller to be sure it's on course. The controller sends feedback to adjust the complex variables, and bullseye. In medical education, the teacher provides the learner with feedback about their performance for the purpose of improving their performance.
Remember, feedback provides information, not judgment.
For this video, we selected 5 elements you can use to ensure your feedback is effective. Provide the feedback in a timely manner. The sooner, the better. Find the most appropriate setting, informally in the hall, team room, or a private location like your office. Sometimes the bedside is just fine. Base feedback on specific behaviors that you have observed, not just heard from others. Allow for learner reaction, make room for a different perspective, and then, together, create an action plan that allows the learner to use feedback soon. We know that providing feedback doesn't exist in a vacuum. It's a complex atmosphere and starts with setting expectations and having a supportive learning climate. It's then informed by direct observation and assessment. And again, remember, the most important part of feedback to your learners is that it's for the purpose of improvement, to get your learner to the target. Let's apply the 5 feedback elements to a common scenario. You have an enthusiastic intern who spent a long time acquiring a comprehensive medical history from the patient. The student wants to be sure he doesn't omit anything important, but the presentation is long, disorganized, and, well, awful. At this point, you have a choice. Do nothing.
What's next?
It's someone else's problem. Give vague, non-helpful generalizations.
Chris, next time, let's try to pare down the presentation a little bit, okay?
Or give specific feedback that actually helps the student improve.
Okay, we're finished rounding. Chris, why don't you and I take a quick minute for some feedback, and we'll catch up?
Good choice. Make sure you label it feedback and that your learner is ready and receptive.
Chris, I want to discuss your presentation from this morning and see if I can help with some feedback. How did it go from your perspective? I can tell that you spent a lot of time with the patient, and I appreciate that you attempted to capture everything. Some of the things I thought you did especially well. Next time, when presenting the history of present illness, I'd like for you, tomorrow, I want you to present again, and this time.
Notice how the attending took a moment in a private area soon after the off-target presentation, how he paused for learner feedback and also created a specific action plan.
Let's practice again with an outpatient scenario. Your enthusiastic resident uses too much medical jargon while counseling the patient.
Ms. Freiger, your echocardiogram showed ventricular dysfunction. This clearly explains your dyspnea and presyncopal symptoms. All we need to do is start some diuretics, a beta blocker, an ACE inhibitor.
After you ensure the patient's needs are met.
So this is good news. Oh.
Provide some feedback. Here's how.
Carissa, let's take just a minute for feedback. How do you think that went with your patient?
I think it went pretty well. I mean, she seemed a little bit confused.
Yeah, I thought so too. It's really important that we use language that our patients understand and avoid medical jargon. So for your next patient, I want you to use language that your own family members would understand. Does that sound okay?
Yeah, that sounds great.
Wow, great job.
Wait, was that effective feedback?
You got the point.
So with these 5 elements, you can land that rocket on the moon.
That feedback was very helpful. Now I know my presentations will be much more focused and informative.
That was really helpful feedback. I'm really glad Dr. Morris took the time to help me realize that.
So don't be afraid to give effective feedback. Your learners will appreciate how much you care and they will take off and hit the target every time.